Hello, and thank you for joining me today to discuss Alzheimer's disease. I'm Jillian Chapman, and I will be your host today. Although many neurological conditions are not initially life-threatening, most are life-altering and chronic in nature. Hospitalization can be very difficult for a person with Alzheimer's disease and related dementias. Today, we will learn more about Alzheimer's disease and provide helpful information to reference when coding for patients with this condition. This presentation is intended for those interested in learning more about Alzheimer's disease, specifically students enrolled in allied health professional programs, as this will be useful to anyone involved in the coding of records involving neurological disease. Coding can change based on the stage of the disease and presence or lack thereof of symptoms. Today, we will describe and define Alzheimer's disease, discuss etiology, and review common signs and symptoms of the disease. Equally important are the treatments, medications, diagnostic testing involved in Alzheimer's disease. Finally, we will review the coding considerations for Alzheimer's disease. First, let's describe and define Alzheimer's disease. Alzheimer's disease affects between 2.4 and 5.1 million people. Alzheimer's disease is a degenerative neurological disorder that typically affects people over the age of 65 and is considered the sixth leading cause of death in the United States. The disease process affects cognitive ability, including language, memory, attention, judgment, and reasoning. Alzheimer's patients experience progressive impairment with common symptoms including short-term memory loss. Impairment progresses eventually to affect problem-solving skills and judgment. In later stages, motor functions become more difficult and leads to eventual inability to care for oneself. Alzheimer's disease begins in the entorhinal cortex of the hippocampus and is caused by neuron death. The disease is characterized by a buildup of abnormal plaques and neurofibrillary tangles. Elevation in levels of beta amyloid 42 leads to the collection of amyloid that causes toxicity. Amyloid deposits occur around the meningeal and cerebral vessels and gray matter, forming plaques. Those with a first-degree relative with Alzheimer's disease have a 10 to 30% increased chance of developing the disease. The most common form of Alzheimer's is linked to the mutations in three genes: the AAP gene on chromosome 21, presenilin 1 on chromosome 14, and presenilin 2 on chromosome 1. The signs and the symptoms can range from mild to moderate and all the way to severe and can help to evaluate the stage of dementia. Preclinical or pre-symptomatic mild symptoms usually include difficulty recalling names or coming up with the right words, losing an item, or becoming more disorganized. Usually it's slow in progression, and the duration from the first symptoms is generally 5 or more years. Mild cognitive impairment, or moderate, is considered the longest lasting stage in which dementia is more pronounced and may include increases in frustration by the patient. This is due to ongoing neuron death, which makes it more difficult to care for themselves. Patients can also be disoriented to time, place, and the current season. The final and most severe stage of the disease is when communication becomes the most difficult and individuals are unable to respond appropriately to their environments. Noticeable personality changes take place and total care is also needed, and the patient cannot be left alone. Personal care tasks and ambulation all require assistance at this stage. So now let's discuss some treatments to do with Alzheimer's disease. Since there is no cure for Alzheimer's disease, treatments are focused on controlling symptoms and increasing quality of life. Various medications are used depending on the level of cognitive decline. Though Alzheimer's is not curable, there are a lot of things that can be done to decrease agitation and confusion for patients. Some of those include cognitive stimulating therapies, which can help maintain or slow cognitive decline, activities that help recall memories and emphasize repetition. Physical and occupational therapies are useful as well. Maintaining familiar routines and surroundings can also help reduce confusion, and a calm environment can help prevent agitation in general. There are several medications that can also be used to help control and treat Alzheimer's disease. Pharmacologic agents used include cholinesterase inhibitors and NMDA inhibitors. Cholinesterase inhibitors are used in mild to moderate Alzheimer's disease and slow the deterioration of cognitive function, though they do not stop or reverse the process. Drugs included in this level are Aricept, Exelon, and Razidine. Partial N-methyl D-aspartate antagonists, or NMDA inhibitors, are used in moderate to severe Alzheimer's disease as well to slow the decline of physical and cognitive functions. Miscellaneous treatments include vitamin E supplements and NSAIDs, but these are no longer recommended as treatments for Alzheimer's disease. There are varying levels of impairment and therefore varying levels of testing and types of diagnostic methods used. Diagnosis begins with a neuropsychological evaluation to rule out any other illness or disorder. If nothing else is found during the neuropsychological evaluation, functional brain imaging may be indicated, which may include PET scan, CT scan, functional MRI, SPECT, EEG, and new imaging techniques which are being developed. Any amyloid PET scan has the ability to measure the buildup of abnormal amyloid protein in the brain, which is one of the key hallmarks of Alzheimer's disease. CT scans are the most common type of brain scan used in dementia diagnosis and therefore are useful in ruling out other conditions that cause similar symptoms to dementia and showing changes to the brain structure that occur in disease like Alzheimer's. Single photon emission computerized tomography, or SPECT, can reveal abnormal blood flow patterns in the brain, so medical professionals can determine if symptoms are from dementia or not related to dementia at all. An EEG, or electroencephalogram, is a non-invasive tool used to detect neuronal activity related to different stages of Alzheimer's. The effectiveness of EEG in the diagnosis and assessment of AD is, in its preclinical stages, has yet to be made fully clear. Coding considerations. There are multiple includes, use additional, and excludes one notes at category G30, which is Alzheimer's disease. Multiple coding may be required, and the timing of disease may impact coding selection. Let's take a closer look.
As previously mentioned, there are multiple includes, use additional, and excludes one notes at category G30. Multiple coding may be required, and the timing of the disease may impact coding selection. So if we go in the tabular and look under section G30, diseases of the nervous system, we arrive here. If we decide to search by typing in the code G30, we end up at Alzheimer's disease, which includes Alzheimer's dementia in senile and presenile forms. As you can see, there are several use additional codes depending on the level of delirium and the level of dysfunction. The excludes one notes excludes the senile degeneration of the brain not elsewhere specified, and senile dementia not otherwise specified. Further down, G30.0 is Alzheimer's disease with early onset, and there are different codes listed for late onset as well as undefined or other Alzheimer's disease manifestations.
In conclusion, we have discussed the key areas involving Alzheimer's disease and have illustrated the importance of proper diagnosis and management. Proper diagnosis of Alzheimer's disease and other neurological disease directly impact the HIM professional's ability to appropriately code encounters for patients with neurological disease. Although Alzheimer's disease is not curable, There are several treatment options and diagnostic tools available to professionals. As HIM professionals, we need to understand the importance of distinguishing tabular notes to assist us in the selection of proper codes. Some illnesses require a specific sequence of coding when conditions occur together, and Alzheimer's disease is one such illness. Thank you for your time today, and I hope you found this presentation to be informative and helpful when it comes to coding for Alzheimer's disease and related conditions. Thank you.